Well, there are 6 active cases of the deadly Nipah virus in Kerala and 2 deaths have now been reported so far. CNN News 18's Rohini Swami spoke exclusively with the State Minister Veena about the measures that are being taken to contain the spread of this infection. Let's quickly listen into this conversation.
The Nipah virus outbreak in Kerala has put the southern state on high alert, and the area where the outbreak took place in Kozhikode has been converted into containment zones, very similar to how we saw during the COVID-19 situation, and only emergency services are in place to ensure that this particular outbreak is as much as possible controlled within this confined area. Now, the Kerala government also has said that this particular strain of the Nipah virus is similar to one that was seen in Bangladesh, and more research and they are doing more detailed investigation about this outbreak as well. Now, to know more about this and the steps that the Kerala state government is taking, particularly with the Nipah virus outbreak here, we are joined by Kerala's Health Minister, Veena. Thank you so much for joining us here at CNN News 18. My first question to you is, how is the situation right now?
The situation in Kozhikode is totally under control. So far, we could identify 6 positive cases and 96 samples who were listed as high-risk contacts. Their samples are also found negative.
What I would also like to ask you is, how did your government know that the case that was indicated as it was a case of fever could be a case of a person who has been infected by the Nipah virus? How did you identify that?
So it was back on 11th of this month that we got an information from a private hospital that there are 2 unusual fever cases, one of which is, and 2 of them are children. At that moment itself, I asked my Director of Health Services, Dr. Veena, to conduct a study on this and also a surveillance in the area, and to contact the private hospital authorities. So that day itself we could do the surveillance, and we did a thorough case study, and we found that these cases were from a place which is close to that place where the Nipah case was reported back in 2018. And also we found that the father of these children, he died on 30th of last month. The case study and the surveillance and also the other details we got from the private hospital led us to think that the cases can be Nipah. So we sent the samples to Medical College Kozhikode, the microbiology lab there. It's BSL level 2 lab plus level 3 facilities. Procedures can be done there. And a high-level meeting was convened at Thiruvananthapuram. Myself, Principal Secretary, State Mission Director, NHM, and other high officials participated in the meeting. And meanwhile, at the same time, we got an information from a private hospital that a man is dead, and he also had fever. He is in his 40s. So we asked the hospital authorities, the private hospital authorities, to keep the body in mortuary with the protocol type packing till the result of that person is also, the sample is also tested. And by 11:30, 12 midnight, we got the first result from Medical College Kozhikode that the samples are positive. And then we sent the sample to NIV Pune for the confirmatory test. But at that moment itself, that on 11th by 9:30, 10, we have decided to observe the Nipah protocols. We have asked the health system to observe the Nipah guidelines on treatment, on isolation, on contact tracing, everything. And now all 6 positive, 2 persons, the 1 person who died on 30th and the second person died on 11th, he was also found positive. And the 4 patients who are under treatment, they are stable now. 1 child is also, he is there in the ventilator, but he is also stable. His health status is slightly improving.
Well, ma'am,